By the end of this video, you'll know the 4 common causes of cancer that most people don't know about, or at the very least, the 4 categories of things that are associated with an increased cancer risk. The first category, which is of course out of your control, genetics. Some cancers are in fact hereditary, either directly or indirectly inherited, and this group accounts for about 5% of all cancers. Examples of cancers that fall into this category include retinoblastomas, certain types of breast cancers, and certain types of colon cancer. For example, there's a variety of genetic mutations that can increase the risk of colorectal polyps and colorectal carcinoma, as is the case with hereditary non-polyposis colorectal carcinoma, or Lynch syndrome, which is inherited in an autosomal dominant manner, meaning that if your mom or your dad passes that gene onto you, you're guaranteed to get said disease. The second most common form of hereditary colon cancer is familial adenomatous polyposis, or FAP. The cause is a mutation on the adenomatous polyposis coli gene, APC gene, on chromosome number 5, and is also inherited in an autosomal dominant manner. In this condition, patients develop hundreds to thousands of colorectal polyps during their adolescent years, and they always go on to develop colon cancer. For this reason, prophylactic removal of the colon is advised at a young age. There are many chemicals or molecules in our environment that make us more prone to cancer. So polyfluoroalkyl substances, or PFAS, are a class of more than 5,000 human-made molecules found in a variety of everyday products, such as plastic, non-stick cookware, cleaning products, paints, carpeting, and more. Now, in certain areas, water supplies have been contaminated with these PFAS, and so drinking tap water in these regions is one of the most common means of exposure. Research currently suggests that these PFASs are closely linked to a heightened risk of kidney and testicular cancer, as well as endocrine complications. So that's why PFAS are also known as obesogens and endocrine disruptor molecules. So in other words, they affect your hormones and they throw your hormones out of balance, and they actually affect the cells to make them more prone to storing fat. What you eat has an impact on your risk of developing cancer. In general, the more processed food that you eat, the higher the likelihood of getting cancer. There's a few reasons for this. One has to do with the fact that a diet that's low in fiber and high in sugar, it makes cells more likely to incur genetic mutations that not only lead to cancer, but promote it. You see, every day the cells of our body incur mutations in DNA. This is how cancer starts, and that's what's called cancer initiation. But our immune system fixes these mutations before things spiral out of control. That spiraling out of control is called cancer promotion, and that's the real issue because that's how it spreads and grows. And guess what highly processed food does? It feeds those mutated cells exactly what they need. Over the last several decades, as we've generally eaten more and more processed food with more and more added sugar, the incidence of obesity-related cancers has gone up. Think colon cancer, kidney cancer, pancreatic cancer, and even liver cancer, especially for those who are in the age bracket of 30 to 50. So how is it that eating highly processed food like Domino's, Dunkin' Donuts, Subway, Doritos, Oreos actually uniquely feeds the growth of those cancer cells? Well, the main culprit is the added sugar, which specifically supplies the backbone for the structural elements that allow those cancer cells to divide and conquer. For example, the ribose molecule comes from sugar. Ribose is what makes RNA, and the deoxyribose is what makes DNA. But that's only part of the story because cancer cells import 200 times the amount of glucose compared to normal cells. Your cells contain an enzyme called PI3 kinase, which opens the glucose floodgates of the cell. If the cell were to open these glucose floodgates, there would be so much glucose that can be used to fuel the cell without even needing the mitochondria or oxygen. And this is why it's no coincidence that cancer cells and fetal cells both have rapid growth and they both have high levels of PI3 kinase. And so some very smart scientists asked themselves the question, well then, what if we could come up with a medication that blocks PI3 kinase because that might actually stop cancer? And so came the development of PI3 kinase inhibitors. In fact, some scientists found that if you first cut down on insulin signaling by reducing the amount of dietary sugar and refined carbohydrate, then these PI3 kinase inhibitors become much more effective. Insulin drives down cancer cell growth because it's how the glucose gets into the cell in the first place. You could think of insulin as being the key to the door, and the PI3 kinase determines how wide that door swings open. Insulin and PI3 kinase work in unison to flood the cell with that glucose. But refined carbohydrates and added sugar aren't the only reasons that highly processed food increase the cancer risk. The lack of fiber contributes as well. And then there are all the other chemicals that are added, especially when it comes to processed meats, things like pepperoni, sausages, and hot dogs. These contain the carcinogens known as nitrosamines. And char grilling food, especially grilling meats, adds another class of chemicals that increases the cancer risk, especially when it comes to colon cancer, and that's something called PAHs. Polycyclic aromatic hydrocarbons. They're a class of chemicals that occur naturally in coal, crude oil, and gasoline. They result from burning coal, oil, gas, wood, garbage, and tobacco. PAHs can bind to or form small particles in the air so they can be inhaled and get into your lungs, but also they can be ingested when they get onto the food from that grilling process. Speaking of smoking and tobacco, tobacco consumption is responsible for about 40% of cancer in men, not just cancer of the mouth, the throat, and the lungs, but also pancreatic and colon cancer. And of course, it affects women in big numbers as well. Chronic alcohol consumption substantially increases the risk of cancer in the GI tract, especially esophageal cancer, stomach, and liver cancer. Then there's ultraviolet light from the sun leading to melanoma, and some sunscreens that contain benzene, which should be banned by now, but some of these sunscreens have benzene in them, which are another carcinogen, so don't get the sunscreens with benzene. And we have certain types of medications like hormonal medications that increase the cancer risk. In chemotherapy itself, while these drugs can cure cancer, many of them actually predispose that person to developing another cancer in the future if they survive their initial cancer. I actually once had a patient, a young woman who had bone cancer, and one of these drugs that she received in her chemo regimen was called Cytoxan, also known as cyclophosphamide. And she ended up beating the bone cancer, but later on, she developed AML, a type of leukemia, as a result of cyclophosphamide, and she unfortunately did not survive her second cancer. Certain viral infections actually increase a person's risk of getting cancer. For example, HIV, that increases the risk of Kaposi sarcoma and malignant lymphomas. Then you have Epstein-Barr virus, which is the virus that causes mononucleosis. And Epstein-Barr virus actually increases the risk of developing Burkitt's lymphoma. Then you have hepatitis B virus and hepatitis C virus, which increase the risk of liver cancer, and HPV, which increases the risk of cervical cancer. Okay, the fourth category is this sort of oddball category that doesn't really fit into the other categories that I mentioned. Here we have various medical conditions that increase the risk of certain cancers. So, cryptorchidism is a condition in which one or both of the testes fail to descend from the abdomen down into the scrotum. It's usually just one testicle, but it can be both testicles. This condition is associated with a higher risk of testicular cancer. Then you have things like Crohn's disease and ulcerative colitis, which increase the risk of colon cancer. Adults who have this condition called dermatomyositis are at an increased risk of developing cancer in general, with about 20% of patients being diagnosed with cancer within 3 years of being diagnosed with dermatomyositis. People with Sjogren's syndrome have an increased risk of non-Hodgkin's lymphoma, and cirrhosis of the liver increases the risk of liver cancer. So those are the four main categories: genetics, environmental factors, viral infections, and various medical conditions. For most types of cancers, genetics is estimated to contribute anywhere from 10 to 30% of cancer development, while smoking and unhealthy diet are the leading factors in 50% of cancers. And if you want more details about colon cancer specifically, then you can check out this video right here.